remove the wisdom tooth always? Really? And if at all we need to get rid of that wisdom tooth, then what are the precautions that we may need to take? There are plenty of questions in our mind, right? So I'm Dr. Kashmira Joshi, and today I'm going to try and answer these basic questions. Okay, so let's get started. Let's start with the basics about the wisdom tooth. When does it erupt? Basically, it erupts at the age of 18 to 20 years. At that time, we already have all other teeth in our mouth to bite and chew. So sometimes what happens is, we start to feel some kind of pain at the age of 18 or 19 when the tooth is trying to erupt in its position. This pain disappears after a few days, and then again after a few months we start experiencing the pain, and then finally the tooth erupts in its position. This pain is basically because of the pressure that wisdom tooth is putting over there while erupting. It finds its way out through the gums into the mouth. Alright, if it erupts properly in its position, if it is straight in there, it starts to function like all other teeth. But if the tooth doesn't erupt properly, what happens is, it sometimes becomes tilted, either buccally towards the cheek or towards the tongue, or sometimes it pushes the front adjacent tooth. Okay, why does it happen? Sometimes between the bone and the adjacent tooth, there is inadequate space for the third molar, the wisdom tooth, to erupt. In such situations, it erupts in its easiest possible way, either buccally towards the cheek or towards the tongue, or tilted towards the front tooth. Sometimes it even becomes horizontal in there. In these cases, it starts to trouble. It is of no use in chewing or biting. What happens is, it leads to a cheek bite or a tongue bite, or sometimes it even starts to damage the front tooth. As in this case, you can see this tooth is tilted, it's almost horizontal, and this front tooth, the adjacent tooth, is decayed because of this third molar. In such situations, the food starts to get lodged here and the patient cannot clean it properly, and then this wisdom tooth starts damaging the adjacent tooth. In such cases, we need to get rid of this tooth and need to treat this tooth as well. So for that, as soon as we realize that the wisdom tooth is not going to erupt in its correct position, it is better to get rid of that tooth. We need to remove the tooth. Now how do we do that? How do we remove it? What we do is, we basically remove the bone around this tooth a bit, and then we remove the wisdom tooth. Sometimes we need to remove it in pieces. We need to split it and then remove it. Or sometimes, if it is buccally tilted or if it is slightly angulated, it may even come out in single piece. So after this third molar removal, there are certain things that you may need to take care of. The first thing is, because we have drilled a bit of bone around that wisdom tooth, there is a chance, rather I would say, surely you may experience the swelling here outside in your cheek region for 2 to 3 days. Then it starts to come down and it starts to get better after 3-4 days. So after going home after tooth removal, what you need to do is apply ice pack from outside. This will reduce the swelling that you are going to experience after your third molar surgery. The second most important thing is, after removing your third molar, you may experience that you are not able to open your mouth completely fully wide. This is very common and it happens. It is okay for your day 1, but second day onwards, it is recommended that you forcefully open your mouth to its normal level, and you start with your exercises of opening your mouth and then doing the movements of your lower jaw. This will prevent the locking of the jaw, and this is going to be better in the long run. If you do not follow this exercising, the problem of not being able to open the mouth will persist and it will worsen. So it is very important to start with your exercises from the day 2 onwards. The another most important thing is, like all other extraction of all other teeth, similarly there is a trauma when we remove the third molar or the wisdom tooth. So it is important that you take care and avoid eating something which is sharp, something which is pokey, something which will go and get stuck there. So you need to avoid such things. You need to avoid spicy food. You need to also avoid spitting out forcefully. Okay, and after removing the third molar or the last tooth, As there is no tooth behind that tooth, we always tend to suture that region in order to get a good wound healing in that region. So basically it is advised to get the sutures removed after 8 days, and you need to continue with the saltwater gargling that you have started 2 days after the tooth removal. Saltwater gargling is very important after you get your third molar removed or any tooth removed. It shouldn't be started immediately, but it should be started 48 hours after your surgery. What it does is basically it helps in cleansing that area. It helps in maintaining hygiene of that area. It helps in flushing out the foodstuffs that are there, if at all. They get cleaned away because of the salt water, and it also helps in preventing the infection in that region. Okay, so after saltwater gargles, it is also important to take your medicines properly on time regularly, and then after follow-up of 8 days, it is important to continue with the saltwater gargles for 2 more days. Taking care of the wound leads to a good wound healing in that region. Okay, if you have any other doubts, feel free to contact us. Thank you.